My name is Tembi Aris. I am a medical intuitive. I use alternative techniques to diagnose and treat illnesses. I've done this for over the years, and I've successfully diagnosed and treated people with the most complicated of illnesses, which have baffled even the best of some of the medical specialists. People call me Dr. Alternative out of endearment. The health industry, or health, has got two dimensions: the alternative dimension and the medical dimension. But unfortunately, these two dimensions don't talk and they don't collaborate, to the detriment of the recipients, that is, the patients out there. I am the epitome of these two dimensions.
Join us on their journey to better health and renewed hope. This is Dr. Alternative.
There's always a bone of contention between alternative medicine and conventional medicine. And who loses? That's the patient, of course. But who can take this forward to make sure that there is collaboration, if there is a need for that in any case? It is the youth. That is why we have got young people in the studio today who are going to give us a taste of what is going on out there vis-a-vis conventional and alternative. So welcome to our show and enjoy it.
Good day, my name is Nosbusiso.
Hi viewers, so my name is Sharial, and today we're gonna have a debate on conventional and alternative medicines. Some people, they don't know the differences between conventional and alternative, and today we're gonna make that clear. Let's go to our first question for our guests. Is there a place for alternative medicine in the health history, or is it just gambling with people's lives?
Well, hello guys, I go by the name of Uluxolo Nondlwana. Well, coming back to your question, I definitely think that the alternative medicine does have a sort of scheming people's money, because they don't really have proof than the conventional one. You know, they're not really sure. It's a term of they trying, but really not sure that will they heal the person or not. So I definitely think that they definitely playing with people's money in that.
Well, much like my colleague here, I am for conventional medicine, and I really believe that, again, it's a matter of modern medicine has a solid base of evidence, while conventional, even though it's been around for longer, actually really doesn't. It's more preventative. While when there's actual serious health issues, a person will go to a modern doctor, right, to treat whatever that illness may be. For example, let's look at the discovery of penicillin. Even though it was discovered by mistake, but its effect was monumental, right? In the sense that even though there was conventional herbs at the time, the science of it, the science of modern medicine saved people's lives. Not saying that there isn't a place, but more or less, I feel like modern medicine kind of takes the cake in a way, yeah.
First of all, I'd like to introduce myself and greet everybody, Senior Chamber of France. I did hear your question. What I will say, I don't see it as a gambling, because it depends on the person, like who's in charge, who's running the business. And then, as we all know, as we are people here, we have different religions, we have different beliefs. And to me, I will say, I don't see it as a gambling. Thank you.
Hi everyone, my name is Yolanda Madla. I don't think it's a gambling. It is not a gambling because there are certain things that can be healed from for the alternative that you get from the traditional.
This is an interesting debate from young people, which is clearly indicating that the understanding of alternative medicine is still lacking. And this is the purpose of having this show today. I talk about myself. I am a medical intuitive, and I'm using alternative methods to scan and to diagnose. And when I profile, I do it medically. I will give a medical profile that says, if you are epileptic, I will say what is causing you to be epileptic. I will not say, okay? I will not say you are being bewitched. I will be able to explain that you are having epilepsy because this is what is happening in your brain. I give you an example. I treat autistic children here. And I'm going to give you one case scenario. Now, here is a child, 9-year-old, I think 9-year-old, who is autistic. Now, remember, children who are autistic, they cannot, most of them, not all of them, they don't have speech. They have seizures. They don't have, they've got emotions. They get emotional outbursts and a whole range of other things. Not all of them are similar, but I'm going to give you this one case scenario. Now, remember, I'm a medical intuitive, not a medical doctor. Now, here comes this child who's been under these doctors, not just one doctor, who's been under a psychologist, a neurosurgeon because of epilepsy, and who's under a pediatrician, and who's under a whole battery of tests and practitioners that are attending. And for years, this child is just sick. He's having seizures, he cannot talk, nobody knows what's causing him to be like this, except that they are saying he's autistic. Okay, so it is expected that when you're autistic, you're supposed to behave in this way. So here comes the child. I scan him. Now, when I scan him, I use alternative methods. I scan him and I discover he's got a condition which is called congenital disorder of glycosylation. That is not an alternative term. That is a conventional term. This child has been under doctors all for the better part of her 9-year-olds, but they don't know what is wrong with this child. All they know is that he's autistic, so he's expected to manifest in all these symptoms that he's manifesting in. Here he comes to me. I use my own scan, but I pick up he has got congenital disorder of glycosylation, which is a metabolic disorder that messes up the synthesis between proteins, sugar, and lipids. Okay? That is a conventional terminology. I am not conventional, I'm alternative. So, and then I say to the parents, this child is having seizures. And they say, no, he only had it once, some couple of years back, but he's never had seizures again. And I say, this child is having seizures. So the child, and I said, when he's sleeping, does he twitch? And they say he twitches all the time. He never sleeps throughout the night. And I say, you know when he's twitching? He's having seizures. He's having seizures. And then I put him on a whole program. And the liver, and I say the liver is affected because the other thing besides the brain being affected, I say the liver is affected. And I say the kidneys are affected. From the same metabolic disorder, because remember, when you are not synthesizing your proteins with your lipids, your nutrition, the body does not accept what has not been properly processed. Therefore, you don't absorb. So, therefore, that's why he's not, the brain is not developing cognitive inabilities. He's got digestive, the liver is affected. He's got kidneys, the kidneys are affected. So I put him in a whole battery of medicine. But what medicine do I give him? Not drugs. Alternative. So, but then I said to the mother, this child, when he starts taking my medication, he's going to have seizures. I say he's going to have seizures. Now you're going to see that he's having seizures. Why? Because now I'm tapping on that area of the brain that is sitting dormant but being lambasted by the seizures. Okay? So, and then she never told me that this child was put on Epilim at the time when he had the seizures once. So I put him on the program, and then she calls me and she says, yo, the bus, a driver told me that this child had seizures. Remember? I said he's going to have seizures. Okay. So the bus driver said he had seizures, so they took him to hospital, and then they put him on the drug medication to calm the brain. But he did not respond. He was going, you know? Put him in ICU, going. And then eventually he managed to calm down, and then was discharged the following day. And then she calls me, what do I do? What am I? Am I a doctor? No. Have I used conventional medicine? No. I'm using alternative both to diagnose and also to treat. Okay, so now she wants to know, and she says, I'm so scared because I don't want him having seizures again. I said, now that we have poked the bear and the bear has come out, now we're going to tame the bear. Then I say, because when he came out, he was given 2 types of drugs, stronger and that Epilim that the mother never administered at the time when it was given. So then I say, first 2 days, give him the conventional medication. Because that conventional medication, it tames that brain. Because we have poked that brain, which was having seizures anyway, but now because we're treating it, so the brain goes wild. So the brain comes. I said, 2 days, you calm the brain. Then the 3rd day, you start administering my medication again, which is what she did. And that child never had seizures after that. Never. And then I say, after so many days, you remove this one. So I actually tampered with the conventional doctor's prescription. And I said, while they say give him more of this and less of this, I say do it the other way around. Give him a stronger of this and lesser of this, and then so many days you remove this, then you give it that, and then you start administering mine. So where do I get the guts? Where do I get the guts to know how to administer even their own medication? Because I've got this medical intuition. And that is not medicine. That is alternative. So, and then I put her on the epilepsy and the whole range of medication. And then she says to me a few days later, she says, for the first time, this child could never sleep quietly since he was born. Now he's sleeping through the night. She says, I don't know what you've done to my child, but I am so grateful. Sleeps through the night. And then I said, okay, even with this, later on, this is what I'm going to do. So I change, add a few of the medication. I'm monitoring and I'm managing the whole process. And then she called and then she sends me a report. She says, this child, when he was growing up, he had yellow hands and yellow feet, which never, we accepted. We never even tried to do anything. We just accepted this is how it is. And she said, they have totally cleared up. That was the liver. Remember when I gave the results, I said cognitive, I said liver, and I said kidneys. And she said, they have totally cleared up. And then I said, okay, we added the kidney medication. And she said, this child was peeing in his sleep and he was on nappies, but now he has totally turned around. He can now pee in the toilet like other children. So I'm giving you this scenario because I want you to understand that the only or most of the information that is out there is very insufficient about alternative, because alternative has never been given a chance to showcase. But now I'm giving you scenarios, and that is why I've organized this debate, because I want you young people to know, hey, there is so much more that is on offer from alternative. And it's not, and this is not gambling. This is, like you were saying earlier, that this is scientific. I mean, alternative is not scientific. It's not proven. I'm proving it. This is just one case scenario. If I were to give you the range of cases that I've treated where doctors who are trained have failed dismally, not only to diagnose, but to treat. But where I diagnose and I treat and I turn things around successfully. So I'm standing in for alternative. Okay, all right.
No, it makes me want to think along the lines of, instead of now this being a debate, rather it be an open conversation so that we can educate each other. Because as I said, there's so much, as you now yourself, you just said that there's so much evidence about conventional medicine that now makes the
about alternative.
And then there's less about alternative that would now make people question alternative medicine. So I feel like if it's an open discussion whereby we can show the avenue where there could be an intermingling of both medical practices, we will be able to now provide a platform where alternative is able to stand on its own. Because even, for example, in your case, let's say there's a patient that has to go for surgery. Fine, the surgery is done conventionally, right? And then we'd find that the alternative would come in for the acupuncture can enter for the pain relief, right? So there could be a partnership. So rather, instead of us having a debate, could it be an open conversation where I could also come up and help them and educate the fellow colleagues that I have here about some of the alternative medicines that I use, even though I'm representing modern medicine.
Okay.
Yeah.
You actually have a valid point, but it is not a mistake that we want you guys, because that is what is out there. You're representing views that are real, that are out there. Yeah, real, both from doctors, from people, because I mean, the reason why you find people still, I mean, this is my experience, that we don't want to pussyfoot around what people believe to be the case with alternative. We want to be brutal, because it is in that brutality that you get to understand that, oh, so this is where they really are. And then you are in a position to teach them, to educate them. So when you're shooting it, I want you to shoot it brutally. Brutally. I'm not making a mistake. I want you to shoot it brutally, because it is in that brutality that I get a chance to educate and say, wow, so I'm not making a mistake. I want that brutal, I want that brutality. So let's continue nailing alternative medicine or nailing conventional, okay?
My question today is, does conventional medicine have enough and relevant training to deal with people's health, or is just money-making scheme? Can I start with this?
I don't think it's a money-making situation in terms of conventional, because conventional medicine is a researched thingy, so it's valuable terms and it's well tested than the alternative. So I really do not think it's a money-making thingy, although it has its strength and its weaknesses. Because one of its strengths is that it's well tested, it's well researched, and probably a lot of people might say that like conventional wants profit because to buy medicines these days are very expensive. But you must also understand that there are jobs that are created, there are pharmacies and so forth. So behind that thing, they also need to profit in that. But it's a very well stated thingy, and it's a very well tested thingy. So I don't really think the main focus is profit than just to heal certain people in terms of health. Thank you.
It's along the same lines as what he said. Modern medicine is well researched. It has a solid foundation. It has evidence, it's proven. And you can always go back to that science and always improve it, right? But again, can you please repeat the question one more time? Is it money driven, right? That's the point. Is it money driven? Now we have to differentiate. We understand that there is corporate giants. Let's not look at the corporate aspect of the question. Let's look at the practical side, the doctors, the nurses that are involved. Those are modern medicine practicing people, right? So they went and did 7 years. We all know it's 7 years. So that's the whole part of it. As I said, it has a solid foundation of evidence that forever improves itself, right? Let me not even go further.
To me, I would say it is a money-making scheme because what is happening at the end of the day, they are making money. But on the alternative, you have to go to a forest and dig, and then you have been given instructions which one to dig up, and then you dig the correct one, and you'll be able to do it on yourself. But on the conventional side, you'll find they are the scientists who come up with all those stuff which is supposed to be used in order to come up with the medicine which is going to be treatment for the patient. So to me, I see the medical scheming. Thank you.
I believe sometimes it is a money-making scheme because, let me not say sometimes, it is a money-making scheme because, especially on private institution, the only thing they're looking for is to profit from you. Because even if you go there for a headache, the only thing they can give you is Panado or Grandpa. Beside that,
this is a known proverb by all of us. There is nothing for mahala. Exactly. All right. It costs money to research. It costs a lot of money. And on top of that, it costs money to even innovate. I understand this is a matter of ethics. Some people feel that, it's so unethical. Why demand so much money? We don't want people to die, right? At the exact same time, let's look at the COVID-19 situation, right? There's vaccines today, right? You can have a child, you know that for the first 5 years, that child is going to get 5 shots, right? Those are these modern medicines that we came up, these vaccines that we tried that are designed to fight against these pathogens that are around, right? That costs money. Whether we like it or not, that is the world that we live in, right? And let's rather focus on the practicality of it, right? The practicality of how well we need modern medicine in today's society, right? It's not a money-making scheme. It just so happens to profit on a very high demand. because every year there's an increase of people, right? And we live in a society now whereby at any point, one cough can kill millions. We saw that with what happened in China, and that stopped the whole entire world. So it will forever cost money. Yes, there might be an avenue that we could explore whereby we can deal with the ethics, but this industry is a well-regulated industry. And in its regulation, money is involved, jobs are created. Yeah, thank you very much.
If you ask yourself, who teaches the researcher? Who teaches the researcher so that he knows that that heart that's pumping is 120/80? You'll say the one before him and the one before, but who's the very first one? Who teaches? It's the body. The body taught the very first person who discovered that the heart is pumping at 120/80 was taught by the body itself, because then you started counting. Oh, it's doing it 120. No professor. That professor, was the student, but the teacher was the body. The teacher was the body. So conventional medicine cannot claim anything when it comes to the teacher. They are the students themselves, but who over the years have become bad. I mean, it's like when you teach your child and your child teaches the child, but who has been the first teacher? It's the parent. Now I give you a scenario again. I'm not talking from the A. I talk from as a researcher myself, but my research is on the job experience. Here is a child. He is having seizures. You know, not a child. Here comes a 30-year-old young man, comes to me. He has got seizures he's been having since he was 3 years old. And you know what was fascinating with these people was that, now remember when you're having seizures, they put you on the EEG machine because it measures your brain waves, that EEG machine, to see where is the abnormality occurring, and then they will say, oh, it's in your temporal lobe or it's in this. But now the difference with this one is he's having seizures, but the machine is showing that the brain is normal. There's no activity. Meanwhile, he's convulsing like this in the bed since he was 3 years. So they put him on medication. He's still having seizures. Now they don't know what to do. Now this professor, the teaching professor in a medical university says, this looks strange. Let me take this child and put him under my wing as my research case. For 8 years, he's studying this child. But he does not get answers as to why does he have seizures that cannot be picked up by the EEG machine. And he gives up and he says, I don't know. This is a man who's done I don't know how many years. He's written papers. He's now a teacher. He's a professor in a medical school. So when you go to do your medicine, you wave at him, you fold your cap because he's now a big man. But you cannot give answers to this. Okay? Here comes the child. Now the mother comes to me and say, Tembi, can you just give me answers? I don't expect you to make this child stop seizures, but I just want to know what is happening with this child. And here comes the child to me. He's not a child anyway, he's a young man. And I scan him and I pick up, no, the problem is not coming from the brain. It's from the pancreas, there, on the bottom. But what's happening with the pancreas? He's got a condition which is called insulinoma. These are conventional terms, not alternative terms. He's got insulinoma, meaning the islet cells that are pumping insulin. Now remember, insulin is produced to stabilize sugar. Takes sugar from the blood, takes it to the brain, to the heart, to the whatnot. But it's produced by the pancreas. But now when you've got insulinoma, that pancreas is pumping too much insulin and then it's chowing all the sugar that is supposed to serve this brain, this one. And then the brain goes into a shock. Then it starts convulsing because there's no energy. That is not an alternative explanation. You would expect that to come from the professor. Okay? Who's done 7 years? Ne? Who's done 7 years and. But he cannot answer. Why is he having shortcomings? Because he's not the teacher. The body is the teacher. And the body is teaching all of us. Okay? So now, if I happen to be this medical intuitive who can be taught better by the body, and then I end up knowing what is going on. But what information am I using? Not alternative information, conventional information. So it's not like they've wasted time by researching, because now they can talk about insulinoma. That's their terminology. They can talk about the pancreas. It's not like the pancreas is created by them, but it's their terms. It's their understanding. They've studied that. But it's studied and then it's sitting there, it's disjointed. That professor doesn't know how to tap on that information so that he can make use of it for the benefit of the patient. So my point is, well-researched, but very insufficient training that doctors have. It doesn't matter if you become a specialist, because even then, I've got so many cases of specialists. You know, I've touched on this one time and I said, this particular journalist, he was ridiculing me when he saw me he said, I want to invite you to come to my show, I'm gonna pay you. And I'm gonna clean my schedule so that I make sure I'm available when you're available. And I said, be my guest. I will come, but these are my conditions. You don't have to pay me. And I will make sure I'm available, but my condition is I want you to bring a cardiologist, bring a pulmonologist. I don't want a GP. I want a cardiologist, I want a urologist, a pulmonologist, a neurosurgeon, pediatrician. I want specialists, and I'm gonna come all alone. But I want you to bring us real patients. I don't want us to be arguing that, I want real patients, a person who's got heart problems come with oxygen and we put him there and the cardiologist must tell, why is this person on oxygen and what can be done? Then I'm gonna come to your show. And that was the last I heard from him. Because, we cannot do that. Even if we were to get those people, they cannot sit like you are sitting and we put a patient there and they'll be able to tell. Because they need a pathologist to check what's going on. They need a CT scan, they need an MRI, and all that is done by pathologists. But they themselves cannot diagnose on their own. They need someone else to do diagnosis, and then that person will, only then do they decide how to map up. So if that pathologist cannot pick up what's going on, they also don't know how to move forward. So that's a shortcoming. So their training is good, but it's not good enough. Which is why I'm saying they need to start looking at alternative practitioners like myself.
You see, when you are dealing with not even millions, billions of patients, at some point, there is bound to be failures. I feel that in as much as we could focus, yes, on the competencies of pathologists and neurologists and all of that, in the same situation, it could happen within a health intuitive, whereby not every case will be solved, right? There are those whereby you could have, but it didn't happen. It is not a matter you didn't want to help. It's just that at that specific case, it just so happened that you didn't win. And I feel like it is there on both sides. I have to shine a light on that. It is there on both sides. Both have their own strengths and their weaknesses. Both have their own risk factors. Hence, again, I understand that the first teacher is the body. And if the person who is trying to interpret what is happening with the body misinterprets, right, it is not the fault necessarily of modern medicine, but is that individual who at that moment was caught by human error. If he didn't, or if he or she didn't have that human error and was able to grasp that issue, then of course, conventional medicine would be able to accurately assess, accurately deal with the problem at hand. I feel like that is what I just wanted to point at. Whereas, you see, for example, it's like, if my friend here is a football player, his position is a striker. His mindset, if you take him and put it at goalkeeper, it's not gonna adjust to goalkeeper very well because his mind is a striker. All right. So again, it's along those lines, to the point that there are players who, if they now are playing different positions, you find that they can be jack of all trades, but they will be master of none. Right. That is the issue at hand. And I hope that within even now, this is now from my lack of alternative medicine understanding, I hope that this doesn't mean that alternative medicine is literally a jack of all trades. There must be at least an alternative medicine specialist of neuro or cardio, right, who would deal with that. Is that available, ma'am? Mhlawumbe you would have the answer. Thank you.
Okay, well taken, point well taken. Now you look at the body. If you look at the body is so many systems, but it's also one system. It's so many systems, but all collectively put together, and they make one system. And these systems talk to one another. So if now you're going to take your cardio and say, me, I'm only looking. Look, this example that I've given you. This is a person who's having seizures. The expectation is that, or the understanding is that it's a brain problem. Meanwhile, the pancreas, that's a digestive organ. It's coming there, but it's messing up that brain so that you're having seizures. And that is exactly where it hits conventional medicine hard, because they've dissected the body and these don't talk. You'll find even when they do surgeons, when they perform surgeons, it will be a cardiac case, but if it's a child, you find they're going to bring a pediatrician, and then they're going to bring a gastro if they are, they bring a whole team of people, different specialists. It would be fine if you may be specializing in your area, but then you are in a position to see the connectedness of the systems, as opposed to if you're having a respirator and then you only sit with pulmonologist. Meanwhile, it's a cardiac problem, but because these different systems in your training have made not to talk, then you end up missing something that's simple. That could have been corrected with ease, but because of the dissection of the body, then you end up making it a mountain. Meanwhile, it's just, you see my point? So that's where conventional, in fact, I'm actually challenging conventional medicine to revisit their curriculum, because it is making them miss out on a lot of things that would have been solved very easily. Before we move on to the rest of our questions, I just want to give you another example. Here is a lady. She was on oxygen machine. In fact, I've got so many of them. I'm trying to think which one I must select. Okay, maybe let me select the one from out of the country. Now here's this lady. She comes because she's been told she's got lung fibrosis. Lung fibrosis, that means the lungs are scarred such that that costin, that accordion, relaxation is compromised. So they are stretched, and she's told, this is it. We cannot fix lungs that are scarred. We can only keep on increasing the amount of oxygen that you're going to depend on. So, and this is your life. So she can't go anywhere without oxygen. She sits here, she's going, and here she comes to me, Thembi, can you do something? I scan her and I say, no, this is not a lung problem. This is a heart problem that is affecting the lungs. And she says, no. I mean, you must not think when I share these things with the patients, they just accept them. Because they're coming from the doctors who told them that, no, this is what's going on, which you've had for you. So me, who am I to say something contrary to what the doctor, the specialist, has said? So I said, no, this is not a lung problem. This is a cardiac problem. And she says, what about, I said, the pericardium, which is the protective cover of the heart. The tissue, there's such serious tissue swelling that heart is not managing to contract properly. And as a result, for it to transport that oxygen is affecting the lungs, because lungs must pump oxygen and then pump to the body. So I said, these lungs are taking a knock, but the culprit is the heart. She says, no. I say, yes, you want me to treat you? I'm going to treat you as I see what is wrong. I'm not going to treat lung fibrosis. I will still attend to the lungs, but where the problem is coming from, we're going cardiovascular. I said, well, if you say so, because it's not like I've got any other solution, because my pulmonologist has told me this is it. So then I say, okay, you tell me. And then she says, you know what? Something that's striking is that one time when I was having episodes of total obstruction, I went, when my daughter was taken to hospital, she said, Mama, don't you think you've got a heart problem? And I said, but why? She said, because your heart is pumping so fast. And she said, but then she said, I did not accept, because of course, when you are not getting enough oxygen, the heart would obviously have issues, So she never bought into that. So now it's not a case of me convincing her now, it's a case of me showing her that I can do it. Because remember, I'm dealing with someone who does not really take my diagnosis, but who has got no alternative. So I start treating her. And then the very first batch, she says, man, I can at least, because she was on 24 hours dependency on oxygen. She says, now at least I can hours without putting the thing. I said, that's just the start. We're going to where you're going to totally remove that and take it back to the pulmonologist. And she says, I am starting to believe it, because this 2 hours is small, but for me is big. So I treated that lady to a point where she totally breathed on her own. Now here she goes to her pulmonologist. And now the pulmonologist, she had an appointment. She would go every 6 monthly to see how much they must increase the oxygen. And she says, yeah, walking. And then he removes the glasses, because he cannot believe I'm walking without oxygen tank. is that you, Mrs. Whatever, I'm not going to mention the name. And he says, come in here. He goes to the room and he says, this is unprecedented in the history of medicine. For someone who's got lung fibrosis to end up managing to breathe on her own. He says, I'm going to write a paper. This is unprecedented. And then he sends her to do other tests to make sure that her oxygen, saturation and everything is kosher. She goes to all those tests. She comes back, everything is like it's a new person. And then he says, no, man. He looks at what the last medication that he gave her and he just cannot believe. And then when she knows she's done all the tests, and then she says, I stopped using your medication 8 months ago. So it's not your medication that has put me where I am today. And she says, the problem with white people, when they are shocked, they blush. They cannot hide it like us. You can see when the face turns pink, then you know this is a big shock because the face turned pink, and he kept on turning the file. So she says, I asked if she has ever heard about you, and he said, no, but anyway, whatever that woman is doing to you, it's working. So what am I saying? Why am I wrapping up your second question with? Because I'm trying to show you that here is the pulmonary, the respiratory system is affected by the cardiovascular system. But because I'm in a position to see the whole body in its entirety, I can see, this system has affected this system. So then I'm in a position to assist both the culprit and the victim.
Going back to my football analogy, so in a way, you like the manager when you're noticing that, okay, the striker's not scoring goals. And he's not the problem, it's just the distribution of the ball. It's not. Okay, I understand, because look, I'm learning so much from what she's saying, because I have a sister who, most in families, a cousin can be a sister. So my sister here, Indombakoti, she has been having this migraine problem for years. Like, she, every day, we're not talking like once in a while, it's every day, and you find that in some days, she's literally immobile. She can't even do anything. She just has to sleep the whole day. And it's gotten me a bit worried now, because we are now entering most the latter stages. We are becoming the parents now. We are the generation. And she's a very loving individual. So it now makes me think, in as much as we've explored modern medicine, as I said, it has its failures. Is there alternatives to that treatment? Like, because I understand, I think, again, as you said, this symptom can show itself, but it could not necessarily be where it is. It could be something there, a fault there at the bottom, a kidney that is not functioning the way it's supposed to function, and it's showing itself at the head. How do you go about that process? What would you do in a case like that?
There are so many different causes for headaches. And like I said, there are even people that you find are having epileptic seizures, but they don't realize, particularly the night ones, because if it affects the temporal lobes, you will have seizures at night. Just last week in the show that we presented last week, there was a similar question. And this young lady was saying, would she have headache? But she would also bleed. She would have nosebleeds. And it got worse when she started having, because the doctor that she went to advised her to make a smoothie of bananas and berries. And she would drink that. And she said then she would bleed like anything, even though she would feel a relief, but then it was worrying them. Why was she bleeding, And then I asked her, how much do you eat of the fruit, besides the one that the doctor had indicated? And the reason why I was asking that, it was because I linked the intake of bananas and berries to the bleeding. Not to the headache, but to the bleeding. So then she tells me that she likes an apple, but she does not really like fruit. She's not a fruit person. She's never really been a fruit person, but she's an apple person. And she takes juice, but she only takes orange juice because others don't agree with her. And you know why I was asking that? Because I could link her bleeding, her headaches, to fruit. What do I mean by that? Now, there is something that most people have been shocked to learn about, and that is fructose intolerance. Now, fructose intolerance, it's people that are born with deficiency of aldolase enzyme. Aldolase enzyme is an enzyme that we use to process fructose sugar. It is stored in 3 places. There's A, which is stored in the tissues, there's B, which is stored in the liver, and there's C, which is stored in the brain. But all it does, it processes fructose sugar. Okay. So when you eat fruit, therefore, and you are deficient on aldolase enzyme, your brain is in trouble, your liver is in trouble, and your tissues are in trouble. And when that is the case, it doesn't mean you will have all of these organs being affected at the same time. You'll find other people who will have serious issues with brains or headaches and seizures. And some, it will not be headaches and seizures. Some you'll find they get irritable. You must not upset them. They go mad. They will hit you and ask questions later when you've upset them. Others you find they cannot sleep. Others, you find the memory, they've got dementia, they forget, unbelievably forget. But it's all cognitive related, because even your emotions, your mood swings, that's also linked to the brain. Not only to the brain, but that is also linked to the brain. So then people who are fructose intolerant means they are not supposed to have fruit since birth. Once you touch fruit, then you find it's gonna hurt you really badly. But hurt you how? It will give you issues of cognitive, which is like headaches will be there. It will give you issues of liver, where you find, I get people saying, they say I'm drinking too much liquor because my liver is packing up. Meanwhile, I've never touched liquor in my life. Because fruit is liquor. Fruit makes wine, liquor is made from fruit, largely. So when you are fructose intolerant, therefore, you're gonna finish that liver even though you're not drinking. The tissues, people who develop issues like sarcoma, which is tissue cancers or tissue swelling or different kinds of things. That's aldolase A, that's all fruit. Then you find, I say to a person, even if I've not started giving you medication, I want you to just stop eating fruit and see what happens. Don't eat fruit of every form. Don't drink juice. Don't anything that's got fructose, don't touch it. And then see what happens. Then you find people are shocked that my headaches, they reduced, they've come down. And meanwhile, I've not done anything else, So that's one. But there's a whole lot of other scenarios. Also, people who have got what is called multiple endocrine neoplasia, which is the swelling up of glands. If, for instance, it hits the pituitary gland, which is the gland behind the head, you'll find you'll have headaches. I just had one gentleman who was due for surgery because he lost even the balance. He could not even drive the car. And they saw that he's got a huge tumor in his on the backside of his brain, and one eye was starting to protrude out. You know, the eyeball was starting to like shoot out on only one side. So, and I'm like, but they don't know what's causing that tumor, and it's not cancerous. This condition, multiple endocrine neoplasia. And I said, well, he was scared to take the operation. I said, well, I can shrink that growth, which I did. And then he said, I can even drive my car. I can walk, I'm not falling over. Because I've shrunk that tumor and I've eased the pressure on the cerebellum. So, but that is multiple endocrine neoplasia. People who have got undiagnosed diabetes, and I get a lot of that. People who've got type 1 diabetes, you find they are not diagnosed, but they're sitting with sugar levels that are skyrocketing, and then it causes serious dehydration. That's why you find people that are diabetic, they tend to be very thirsty because it makes them dehydrated. Then you'll have dehydration headaches. You take medication. So there are so many causes. But when I put you on that scan, I will be able to tell you that in your case, this is the cause. It's been a very interesting conversation. Eh?